Welcome to
영국 Mango.
So today I really wanted to walk you all through the London medical system, which I found it quite different from Korean system. So I invited my doctor friend in London for this podcast, right?
Yeah, that's right. Hi.
Yeah, so today I'm going to ask you some questions that the viewers can learn more about how the medical system works, how's the hospital. The big difference is that London have a public health system.
Yes, that's correct.
UK, I mean. So what does it mean by public health?
So, medical system in the UK is free at the point of access, meaning everyone is paying for the NHS, that is the National Health Service, with their tax. But when you're going to use the service, it's free.
There was like an NHS fee. That's one of the big portions that took part when I was applying for my visa. Because I remember, I think roughly the amount that I paid for 3 years visa, it was about £4,000,
Wow.
which was really big amount, which I kind of felt like I'm scammed because I liked the purpose of public health, that everyone should have access to those healthcare system. But I don't think I would use that much money actually. Right?
I guess that's the idea. So when you're young, you might not use it, but you're paying the tax forward. So if you continue to live in this country in the future when you might need the health service more, then it's your tax money as well as everyone else's who's allowing it to be free for everyone.
Oh, and you also got to tell us about, because it's public health, how do they treat all the staffs working in hospital?
Not the best. I imagine it's quite different from Korea. It's definitely different from most places around the world. So I work on average 48-hour weeks, but it can range anywhere from 40 to 70 or 80-hour weeks.
Wait, they don't pay you if you overwork over 48 hours?
You get paid sort of slightly more for out of hours, meaning anything after 5 p.m. or weekends. But, compared to, I think it's something around 35% more per hour compared to normal weekly hours.
Yeah, but still, you mean like in a compensation-wise?
Yeah, it does not feel like it's enough most of the time, for sure.
Yeah, I think that's a downside, especially, working as a doctor. It's such a stressful field. You're under the constant pressure of all the patients flowing in.
Yeah.
And you need to make a right judgment call.
Yeah, and unfortunately the system is struggling, one could say, because of different factors in the last few decades. The system has kind of lagged behind what's required of it. The population is aging, everyone is living for longer and getting more sick from more and more diseases. Waiting times are much longer. Maybe we can talk about what I mean by waiting times. So GP again,
Yeah.
hospital system.
Yeah, the GP, that's the thing that I struggled most when I got sick in London at first. So what does GP mean?
So general practitioner is what GP stands for.
Yeah, so when you feel sick in UK, you need to go to your own GP.
Or to A&E.
A&E, it
So
means...
that's accident and emergency, or emergency department. It's the same thing.
Yeah.
So if it's something that needs care now and then, you have to go to the emergency department. And most hospitals in London and around the UK will have an emergency department. If it's something that's not as urgent, then you have to wait for a GP appointment.
Yeah. So GP is like a personal, not personal, but like, how would I say?
It's like a family doctor in the US. I don't know if you have something similar in Korea.
No, not at all. In Korea, when you get sick, you just go to any hospital. Well, most of them have like really good facility, kind of high-end techniques, and all the like medical charges, it'll be mostly covered by health insurance. So the amount I pay would be very minimal. For example, if I go to like some hospital in my town and if I caught a flu and I just want to get diagnosed and simple treatment, sometimes I only pay like £2.
Wow. Whenever there is, arguments about the NHS and people talk about needing to reform the NHS to change it for better, they always show Korea as an example of a good healthcare system. So, it makes sense that things are a lot better set up in Korea.
Yeah, 100%. You should definitely visit Korea.
I should.
Yeah, maybe. He is
Maybe
kind of
one day.
planning. So about GP, so when you go to GP and have like simple treatment or see doctor, and then what happens next? Like if you want to get extra steps further.
Yeah. So the GPs can deal with a lot of common things by themselves, but if it's something they feel that they cannot manage,
Yeah.
then they will refer you. They will make a referral to hospital doctors. So let's give an example. Let's say you have gone in and you have been coughing for a month. The GP will do simple things like they can do some blood tests, they can do a chest x-ray. But if they still don't know the reason for your cough after that, they might refer you to a lung specialist in the hospital. So we would call that a respiratory doctor.
Yeah, but I find it quite stressful because in Korea, if you wanna, go to another hospital, you just need to go to the bigger hospital next door, for example. But the waiting time between this like GP and having extra X-ray waiting and the next step, it can take up to like months, like over a year.
It depends on how urgent it is. I think one thing the NHS is still good at is more severe and urgent things like cancers. They get seen quite quickly.
Oh, really?
Yeah. So when you're worried about a cancer, then you will get seen by a hospital doctor quite quickly. But if it's anything less urgent, it can take weeks or even months. If you need scans like MRI scans, they can take months or even years sometimes if it's not something urgent. And that's unfortunately where the NHS is really struggling.
I can totally understand that. There are some things I want to ask you.
Of course.
Which part of hospital are you working in right now?
So I am working in care of the elderly department right now.
Yeah.
Meaning I look after people who are 75 years old. And they need special care because these people tend to have many different conditions. And what we are good at is looking after how those different conditions interact and take what we call a holistic approach to the patient, meaning we look at all aspects of their care rather than focusing on individual conditions.
That's nice. Oh, I also got another question because my mom works as a nurse. I wonder how's the relationship between doctor and nurse?
It can be good, it can be bad. I've had both experiences, both good and bad experiences. I think when I'm working with a really good nurse, it feels amazing because, things get done for the patients.
Yeah.
But the nurses, just like the doctors, are very, outstretched sometimes. They can have a lot of things to do. So sometimes, I might ask a nurse to do something and it might get delayed a lot, which can be bad for the patient, but also bad for, me. It can anger me sometimes. So sometimes because of that, the relationships can be bad. But we just have to all remember that we are all in a sinking ship, to be honest with you, rather than, anyone not doing the best that they can.
So would you say the relationship is horizontal?
Probably more horizontal than in Korea, I would think. There is a lot of emphasis in the NHS about, they call it a flat hierarchy, meaning, if you think that something is wrong and a patient is coming to harm as a result of it, anyone should be able to express their concerns. So, nurses, doctors, or, other like medical students, physiotherapists, whoever it is, they should be able to voice their concern.
Speaking of what you mentioned about how NHS emphasize on this like open communication, one thing that I found it pretty interesting was you said throughout your training, you also have lessons about how to communicate with patients, because UK doctors, I felt they're really good at explaining. They explain it in an easy way that everyone can understand. They make the patients feel really relieved and comfortable about the treatment I'm receiving.
So I completely agree. I mean, there is a lot of focus in medical education in UK about bi-directional decision making, meaning we don't make decisions for patients. We give them the information they need to make a decision themselves about their own care. So if I tell someone, for example, to stop smoking because it's bad for their lungs, I can tell them why it's bad, what are the risks of continuing to smoke. And if I'm happy that they understand the risks and they still want to smoke, it's their decision to do so. So I cannot, force them to not smoke or anything like that. It's same with medications and, not taking them, or surgeries. It's all the same.
That's really interesting, but also great in a patient's perspective. But I assume there can also be downside, because if patient says no, there's nothing you can really force about.
I guess, yeah. I mean, sometimes it can be quite, unsatisfying or frustrating. But I just have to remind myself that, you cannot know what people are thinking, and their decision making probably makes a lot of sense to them, even though it might not to me at all times.
Yeah.
I find it a reflection of the emphasis in the West about individual decision making and, empowering individuals rather than telling them what to do, which might
makes
be
sense.
Makes sense to me. Our viewers can make that up their own mind.
Leave us a comment. The other thing I want to ask is, we're passing 10 minutes. What's the best part and the worst part of your job?
Ooh, I think I'll start with the good. I think the best part is whenever I'm going home and I've finished the shift, I always feel like I have made a difference to someone's life. Whether that's something as big as, literally saving their life, like by doing chest compressions or bringing them back to life, or it could be something as small as making someone smile or speaking to someone's family and explaining to them what their loved one is going through. It doesn't matter, every day I feel like I have accomplished something, and that makes me feel really, really fulfilled at my job. On the downside, sometimes because of the bureaucracies of the NHS that we were talking about, it can be difficult to get some simple things done. For example, not every hospital has every specialty, so sometimes patients have to wait days and days to get simple things done because they have to go to other hospitals, or because everyone is busy, they can wait days for certain scans in hospital, and those can be really frustrating sometimes. So I would say the good things about medicine are global. The bad things about medicine are specific to the NHS.
Okay, no comment on that. I think we're almost done with our tea, right?
Yeah.
Thanks for watching, and we'll leave a link for the materials for our video. Please take a look. And if you have any other questions about how the UK's medical system works, or any other treatments you're interested, let us know
In the comments. Bye.
Bye.